Honourable member for Edmonton Calder, followed by Strathmore.
Well, thank you, Mr. Speaker. This morning, a senior government official actually told Public Accounts that we have too many long-term care beds in Alberta. Maybe he should say that over 1,000 Alberta families actually are waiting for long-term care beds for their loved ones, or the 700 of those who are waiting for an acute care bed. To the Minister of Seniors, will you explain to those families how you have lowered the standards of care so that a shortage of long-term care beds has magically turned into a surplus?
The Honourable Minister for Seniors.
Mr. Speaker, the question on the long-term care is best directed to the Minister of Health, but I can elaborate on the discussions that happened this morning, and I was in that room, and I recall the department official talking about an overcapacity in the province in general. We're recognizing there are shortages across the province, just like we do in education. We have an overcapacity of classrooms and schools and space, but we don't all have those in the right communities. And so we have a real issue that the Premier's identified, that we are addressing and we are investing in, and that's to make sure that we have space for our parents and our grandparents.
For a supplemental.
Well, Mr. Speaker, given that just last month we heard about a woman who developed a fungus on her body after busy, overworked staff were not able to bathe her frequently enough, and given that these stories have become all too familiar to Albertans as this PC government continues to downgrade every aspect of seniors' care, to the Minister of Seniors, why won't you commit to providing the level of care our seniors actually need, not based on attempts to penny pinch, but based on inherent respect and dignity of Alberta's seniors?
The Honourable Minister of Health.
Mr. Speaker, I don't want to speak about individual cases, but in that individual case, Alberta Health Services jumped on it right away. It was a problem. They dealt with the issue. But care for every one of our seniors in every one of our facilities, as I've indicated throughout today, is very important. Our parents, our grandparents are precious to all of us, and we will continue to do the best job possible in this province. We make sure that people get the best care, some of the highest level of care in this country. We are more than other provinces as far as giving care in this province.
Final supplemental.
Well, Mr. Speaker, given that this PC government is determined to continue their smoke and mirrors exercise of downgrading care so that fewer seniors get the full nursing care that they require, and given that the fact in Alberta today we have the second lowest number of long-term care beds in the entire country, to the Minister of Seniors, do you honestly think that our health care system has too many long-term care beds, and that is it acceptable to abandon and neglect seniors who are being shuttled off to lower-grade care at exponentially higher monthly rates at private facilities?
The Honourable Minister of Seniors.
Mr. Speaker, I think this government under this Premier has demonstrated very clearly that we have a priority on seniors, and we believe that there is a need for more spaces and that there is a need for more long-term care. But there's also a need for more supportive living. Mr. Speaker, one of the focuses of this government is to make sure that people can age in their community, the communities that they help build with their families. And by just building long-term care, just having long-term care, without the supportive living, the dementia units, so people can age in place and beside their spouse in the same facility as their spouse, you're going to split up spouses and you're going to send them to the next community. That's not a priority of this government. That might be what the opposition would like to see us do, but the Premier's mandated that we want to put an end to that.